Your health is your most valuable asset, and once it's gone, it's gone. It's really hard to get it back, and it's probably going to cost you a ton of money. And it's crazy how much your oral health and the rest of your body health are connected. There's so many diseases and problems in your general body that are linked with problems in your mouth. This includes heart disease, pneumonia, pregnancy problems, diabetes, and even Alzheimer's. And there's actually some more, but this just gives you the picture. And the unfortunate part is that so many of us neglect our health. We're so caught up with our work and other things that we don't really think about our health until there's a problem. But the thing is, guys, our bodies give us some signs or some check engine lights that something's going on. And a lot of that starts with your mouth. So I'm gonna give you guys 7 urgent signs that your teeth and gums are not healthy and should be checked out by your dentist. Number 1 is your gums look red. Healthy gums have a nice pink look to them, and this varies depending on your race, but this is generally the color of healthy gums. And healthy gums are also pretty firm to the touch, and they have the texture similar to an orange peel. But unhealthy gums will look red, and that means that they are inflamed and something else could be going on, and you should be going to the dentist. Number 2 is your gums are bleeding. It's not normal for your gums to bleed, and if your gums are super inflamed, they're probably gonna bleed when you brush and floss. I absolutely hate it when people say they don't floss because it makes their gums bleed. Dude, your gums are bleeding because they're inflamed and they need to be cleaned, and they should actually be flossed more, not less, to stop them from bleeding. And if your gums are bleeding, that probably means you need to go see your dentist and get your dental cleaning. There are other reasons your gums can bleed too, and this is why it's important to visit your dentist every 6 months. Number 3 is it's been a while since you've been to the dentist. Just because everything feels fine and looks fine, it doesn't mean everything is fine. If you've held off going to the dentist for a while, and it could be really easy to push off. You miss your 6-month recall, and then one thing leads to another, and now it's been 6 years. You don't know everything that's going on because you haven't had your x-rays updated, and you can't see everything that's going on because your dentist hasn't looked in there. So if it's been a while since you've been to the dentist and you're just waiting for the right time, don't wait till you're in pain. Your teeth shouldn't be painful. They should just feel normal. And this leads us to number 4, which is pain. Again, don't wait for pain to go to the dentist. This is my biggest pet peeve. I find something wrong with your tooth and you tell me that, oh, it's not bothering me, I'll just wait. Well, the last thing you want to do is wait for something to start bothering you before you get it taken care of. Because usually when something starts hurting you, that means that it's more complicated and some more procedures might be needed. That means it's going to cost you more money and it's going to be harder to fix in the first place. Number 5 is you see some tartar or plaque building up on your teeth. So plaque is basically clusters of bacteria that get built up on your teeth. Over time, this plaque can get mineralized and it can get harder, and this turns into tartar. And a little bit of tartar isn't so bad. It's really common to get some on your lower front teeth, and you can get this pretty soon even after your dental cleaning. But the only way to remove tartar is at the dental cleaning. Once this plaque gets hardened and it turns into tartar, it's basically stuck or glued to your teeth, and brushing and flossing won't get rid of it. Like I said, seeing a little bit of tartar build up slowly after your cleaning isn't a big deal. But when you start seeing more of it build up throughout your mouth, and it's been a while since you've been to the dentist, now we're talking about something urgent, and there could be some form of gum disease going on, and you should definitely go to your dentist to get them clean. And depending on how bad it is, you may even need a deep cleaning. And I actually made a video about what a deep cleaning is and how it compares to a regular cleaning, and I'm putting the link to that video in the description below. The 6th urgent sign that your teeth are not healthy is your teeth are loose. Usually when your teeth are loose, it means that there's less bone that surrounds your teeth, and it means that they're at risk of falling out. One of the reasons this can happen is if you have advanced periodontal disease. Periodontal disease is basically gum disease that's gotten so bad that it started affecting the bones that surround your teeth. The more this is left untreated, the more loose your teeth can get, and the more you risk losing your teeth. The 7th urgent sign that your teeth are not healthy is if you see any swelling. If you see any swelling or pus forming around your teeth, this could be a sign that one of your teeth are infected. And again, it's hard to say exactly what this could be because there's a few other things it could be as well, but it's definitely not normal and it should definitely get checked out. So if you ever see any swelling around one of your teeth or something just doesn't look right, I would definitely go to your dentist. Thank you guys for watching. I hope you liked that video, and if you haven't already, please hit the thumbs up button and subscribe to my channel below. I'll see you in the next video.